Good evening. This is Akashvani Kohima. I am Jonas Yantan with Evening News. The headlines: 9,662 people living with HIV in Dimapur, Chumoukedima and Niuland. Health official says PLHIVs could be significantly higher due to underreporting and social stigma. Nagaland to make maiden entry to Miss Universe India from this year. NVCO comes out in support of state government's direction to enforce banning of unauthorized collection by NGOs. And State NHM Director Dr. Akuo Sorhie says community mobilizers are forerunners between community and health services. Now the news in detail. Nodal Officer of Integrated Health Campaign, Nagaland State AIDS Control Society, NSEX, and Deputy Director of Sexually Transmitted Infections, Dr. Zaiwang, today said districts of Dimapur, Chumoukedima and Niuland have an estimated 9,662 people living with HIV. However, the actual number of PLHIVs could be significantly higher due to underreporting and social stigma. He was speaking during the launch of Integrated Health Campaign in Dimapur. Comparing to India's HIV prevalence rate of 0.22%, the officer noted that Nagaland's rate is alarmingly higher at 1.61%, making it second highest in the country after Mizoram. Dr. Zaiwang reported that out of the estimated 9,662 PLHIV, only 3,034 are receiving antiretroviral therapy ART as of March 2024. This leaves 6,628 individuals without treatment, highlighting urgent need for increased outreach and support services. The campaign data also detailed targeted interventions for high-risk groups, including injecting drug users, female injecting drug users, men who have sex with men, transgender individuals, female sex workers, truckers and migrants. EAC Dimapur Imli Jungla urged various stakeholders to work together to ensure that these programs are effective and sustainable. Imli Jungla stressed on early screening and prevention, adding that health issues among pregnant women was high. From April 2023 to March 2024, a total of 48,777 individuals were tested for HIV across Nagaland, with 960 testing positive. Among these, 919 were general clients and 41 were antenatal care clinics, indicating a significant number of HIV cases among pregnant women. For the very first time, Nagaland will be participating in Miss Universe India. The Beauty and Aesthetic Society of Nagaland, PASN, will be officially launching Miss Universe Nagaland India on the day of the audition, which is slated on July 2 at Niuland Resort in Chumoukedima. Addressing media persons in Kohima today, PASN President Mele Pucho informed that PASN has obtained a franchise of Miss Universe Nagaland under Glamanand Entertainment Private Limited. He exuded happiness that Nagaland will be sending a candidate to represent the state for Miss Universe pageant from this year. From next year, winner of Miss Nagaland will directly represent the state. PASN President, who is also State Director of Miss Universe India, said this would be a once-in-a-lifetime opportunity, as only this year there will be an open audition and invited interested candidates to participate in the pageant. Media and Information Secretary of PASN, Sarah Konyak, informed that entries will be open for 18 years and above, with a registration fee of 1,000 rupees from tomorrow. She said participants should be an indigenous of Nagaland. Interested individuals can register online by contacting these numbers 764100 7449 or 7005 284814. For online registration, one can apply the on-spot registration on July 2 from 9:30 a.m. to 10:30 a.m. Nagaland Voluntary Consumers Organization, NVCO, has come out in support of the state government's direction to enforce banning of unauthorized collection of money by NGOs. NVCO President Kezokoto Savi appealed that as per the said direction, district administration and police authorities have been asked to strictly enforce the order to prevent and curb unauthorized collection of money by unions, associations, NGOs, or any other private and community organizations by whatever name. The NVCO also expressed its surprise to see the statement of Dimapur Municipal Council Employees Welfare Union requesting state government to allow DMC to collect urban utility fee or entry fee from all commercial vehicles entering DMC jurisdiction. NVCO further requested the state government to issue a similar order banning illegal deduction of public funds, especially meant for development, in the form of commission or percentage party fund, which seriously affects the quality of work undertaken by contractors. State National Health Mission Director Dr. Akuo Sorhie has described community mobilizers as forerunners between community and health services. She was addressing a 3-day training of trainers of district community mobilizers and block ASHA coordinators on expanded packages of services under Comprehensive Primary Health Care (CPHC), which began today at Ayushman Bharat Health and Wellness Center, Kohima. The director pointed out that with the paradigm shift, health care services envisages towards universal health coverage and to bring health care to all. Therefore, to reach the unreached population, she said ASHAs play a key role. National Health Mission State Program Officer Dr. Maiden Senlem said National Health Policy of Universal Health Coverage is all about delivering healthcare services at the doorstep of the people. She added that 80% of deaths and disease burden are now shifted to non-communicable diseases. Participants will be trained on additional extended packages of non-communicable diseases, oral health, ENT, eye, elderly care, palliative care, mental health, emergency care like burns, trauma and accidents. This news comes to you from Akashvani, Kohima. You can also listen to this news bulletin on News On Air app and YouTube channel AIR News Kohima. Chief Minister Niuland has expressed sadness on the demise of Zelul Sope, father of KB Boti Sope, MLA of 14 South Nangami 1 Assembly Constituency, who passed away at Kohima today. In a condolence message, Chief Minister said Zelul worked under the government of British India as Ardali during the pre-independence in the 1940s and later served as a deacon at Jakama Baptist Church. Rio described Zelul as a man of few words who was always firm on his decision, besides a loving and caring father who nurtured his children to be kind and honest. In his demise, the family as well as Jakama village have lost a pillar, the Chief Minister added. Rio also urged all to thank God for his fulfilled life and cherish wonderful memories left behind. The Chief Minister said in this hour of bereavement, his family joins him in conveying the deepest condolences to the bereaved family members. Krishi Vigyan Kendra Gifre today held interactive meet of scientists, policy makers, implementation agency and progressive farmers in Gifre. Gifre DC Tamsuwati Longoma said providing farmers with opportunities is a sustainable means for the community. ICAR Regional Coordinator Dr. H. Kalita said the state has high potential for livestock as the demand is high. He also called upon the farmers to venture in this area. Nagaland Board of School Education has informed that National Board of Quality Promotion, Quality Council of India, under the Ministry of Education, Department of School Education and Literacy, has announced second edition of Quality Summer Fun Camp through an online platform. The theme of the camp is Safety Stars, Shining Bright with Quality. It aims to impart awareness about the significance of quality in an engaging manner. The camp has commenced on 15 April 2024 and will conclude on 30th June 2024. Participation in the Quality Summer Fun Camp is open to all students from kindergarten to 12th standard. NBSC has requested head of institutions to disseminate the information and encourage students to participate in the fun camp. For further details, one may visit the link sfc.qci.org.in/camp/2024. And now it's when the news. Here are the headlines again. 9,662 people living with HIV in Dimapur, Chumoukedima and Niuland. Health official says PLHIVs could be significantly higher due to underreporting and social stigma. Nagaland to make maiden entry to Miss Universe India from this year. NVCO comes out in support of state government's direction to enforce banning of unauthorized collection by NGOs. And State NHM Director Dr. Akuo Sorhie says community mobilizers are forerunners between community and health services. That is all we have in this evening news bulletin. Good night.